Welcome to Make Drop Matters, the space where bold questions meet road trip. I'm your host, Trish. No filter, no fluffy. Today we are diving into a heavy, heartbreaking, and heated topic. Why are undocumented foreigners being denied access to life-saving healthcare in South Africa, even at death's door? Sitting with me is Sbu Dlamini, spokesperson for the Department of Health. Sbu, welcome to Make Drop Matters.
Healthcare access in South Africa has become a matter of life and death, but not in the way you might expect. When hospitals start on checking passports before pulse rates, we have to ask ourselves what we value more, national borders or human lives.
Let me tell you what's fascinating about this whole situation. It perfectly captures a crisis playing out globally, where practical governance collides head-on with basic human rights.
You know what really struck me in researching this? Nearly 30% of doctors in some South African provinces are foreign-born. So we are literally talking about a system where healthcare workers might be denied care at their own hospitals.
Let me add something crucial about the numbers here. South Africa's public healthcare system serves about 84% of the population, with less than half of the country's total healthcare spending. That's the context we're dealing with.
Well, here's where it gets even more complex. The government's defender makes this argument about limited resources and system collapse. They say it's not about discrimination, it's about survival. But then you hear about cases like a pregnant woman being turned away from 3 different hospitals.
Well, that brings up an important point about economics. Have we seen any data on the actual financial impact of treating versus turning away foreign patients?
Right, and you know what makes this even more challenging? The historical context. Zimbabwe and other neighboring countries sheltered South African freedom fighters during apartheid. Now the citizens can't get basic medical care. The irony is pretty stark.
That's exactly the kind of contradiction that makes this story so compelling. How do you justify turning away the very people keeping your healthcare system running?
That's exactly where this debate gets interesting. The disconnect between cultural values and current policy is stunning. And here's something that rarely gets mentioned. Studies show that preventive care access actually saves money in the long run. When people can't get basic care, they end up in emergency rooms with much more serious and expensive conditions. So here's what's fascinating about that. A recent study showed that the cost of treating foreign patients is actually a little less than 5% of the total healthcare budget. The real strain on the system comes from mismanagement and corruption, which accounts for nearly 25% of healthcare spending being wasted.
Those numbers really put things in perspective, don't they?
They do. And let me tell you about something else that's rarely discussed. The underground healthcare networks that are emerging. When people can't access official care, they turn to unregulated alternatives. We're talking about backroom clinics, unlicensed practitioners, and dangerous self-treatment.
That's a serious public health concern that affects everyone, regardless of nationality.
Exactly right. And you know what makes this even more complicated? The policy is affecting South African citizens too. There have been numerous cases of citizens without proper documentation being turned away because they're assumed to be foreign.
Let me wrap up with this thought. Perhaps we're asking the wrong questions entirely. Instead of who deserves care, maybe we should be asking, how do we build a system that works for everyone?
You know what? That gets right to the heart of it. As we close today's show, I keep coming back to that powerful suggestion from the debate, life first, passport later. Sometimes the simplest statements carry the most weight.
And we will keep facing it every episode if we have to. So thanks for standing in the heat today. This conversation isn't over, not until the last human being, foreign or not, gets treated with some damn humanity. Thanks everyone for tuning in. Meet again on our next episode. We are going to invite our fellow Zimbabweans and one of our African department hospitals to come, and we will have to interview them. Thanks for tuning in. Until next time, Drop Matters is out.